well-being of our people.
As religious leaders, we are entrusted with a sacred duty to nurture this heritage, body, mind, and soul. Immunization is a powerful tool, a gift from God through the efforts of the Uganda National Expanded Program on Immunization, UNEP in brackets, protecting our children against 14 preventable diseases, including polio, measles, and rubella, by uniting interfaith leaders, Catholic, Protestant, Muslim, Orthodox, Seventh-day Adventist, born-again, and cultural leaders of Uganda Kingdom. We can restore trust, counter myths, and ensure every child is vaccinated. Our role as faith leaders is clear. We must use our pulpits, our pastoral networks, and our community platforms to champion immunization as an act of stewardship and love. I commend 3FHI for uniting us across faith and sectors, recognizing that health is a shared responsibility. I pledge my support and call on all of us to sign a commitment statement, train champions, and speak boldly about immunization in our churches, mosques, and community gatherings. Together with the Ministry of Health, cultural leaders, and our communities, we can ensure that every child in Wakiso and across the country is protected.
Wakiso has interesting demographics. It has the refugees, fishing communities, it has the elites, it has the rural aspects, it has the slums. It's such a very complex, dynamic community, but we have the right strategies. We also add digital as one of the strategies that we are going to advance. And our main focus is going to make sure that we address the zero-dose challenge in the country. And Wakiso is leading in the country to have the zero-dose children, and even those that don't complete immunization, despite the fact that actually the district has elites and is peri-urban.
Because their cultural perspectives are different. The language is another thing. How are we going to breed? And these are particularly in Wakiso District and also Kampala, same thing.
Engagement. All of us must come together. Let me bring some examples here. Number one is education, which we all need to fight ignorance. We all need to work together to fight ignorance.
Of vaccine preventable diseases. The Kabaka Foundation has also led the strengthening of healthcare delivery approaches, health promotion, health education, focusing on early detection of management of non-communicable diseases, community screening and access to basic treatment in the underserved areas. But equally, the Kingdom has also constructed the health facilities. Two are already operational at Kalasa in Bulemezi, and another one is in Sanji. And hopefully, come next month, on the 1st, we are going to open doors for patients to the facility at Busimbi in Singo. The Kingdom of Uganda is proud to support this initiative, which employs an interfaith-led multi-sectoral approach to zero-dose and under-immunized children. The Kingdom of Uganda pledges its full support to this initiative, including mobilizing our networks and resource to achieve the project's objective.
Because we use a multi-sectoral approach, that we use what we call interfaith-led model through multi-sectoral approach. That means we work with our leaders, the religious and cultural leaders, we work with media and all other partners. That enables us to reach everyone in the community. So we hope that we'll be able to reach everyone in the community.
That you need to understand. One of them is what we call zero-dose children. Zero-dose children, in terms of program, those children that actually have not yet received the first dose of DPT. But in absolute, these are children who have not received a single dose of vaccine.
But we know from our public health perspective that the non-health actors are very, very instrumental when it comes to promoting immunization. Historically, we know that the Kingdom of Uganda has been very, very instrumental in promoting immunization, not only here in Uganda, but of course also within the entire country. We also know that the religious leaders have been very, very instrumental. We really rely on the two. And of course, the uniqueness in Wakiso, just like other parts within Central Region, people here tend not to listen to the elders the way it may be, say, in the north. In the north, you may find that their elders, one is not a cultural leader, one is not a religious leader, but is a respected elder. And people will listen. People here may not actually listen to the elders. So that is a gap. And so we heavily rely on the religious leaders and the cultural leaders here to be able to promote our public health interventions.
Community members, the mothers that eventually come to the facilities, always interface with faith leaders. Sometimes they interface with you on a weekly basis, but they may come to the clinic or to the facility once in a month, maybe sometimes in a quarter. But you sit in a very unique place in that you get to see them on a weekly basis or sometimes twice every month as faith leaders. And it was recognized that I think you play a very important role in continually sharing key messages on health, and in this particular issue, key messages on the role of vaccines and immunization.